Hi, this is William Ramsey. Welcome to William Ramsey Investigates. On tonight's show, I'm going to record the 22nd episode in my Bioweapon Blues series. The title of this episode will be Probable Causal Association Between India's Extraordinary April to July 2021 Excess-Mortality Event and the Vaccine Rollout. The author is Denis Rancourt, PhD. Last name is spelled Rancourt. And it is published in the Correlation Research in the Public Interest document on December 6th, 2022. And Dr. Rancourt gave me permission personally to record this into the record and into the series. And I will put a link to where this article was posted and his website in the show notes so you can reference that and look at this remarkable article yourself. I do think it's incredible. Some of the information here, it's based on other research that he compiled and put together for this paper. And again, I will repeat, the title is Probable Causal Association Between India's Extraordinary April to July 2021 Excess Mortality Event and the Vaccine Rollout. And again, Denis Rancourt. Abstract. India experienced a unique, sudden, unprecedented, and extraordinarily large excess all-cause mortality event in April to July of 2021, which is not adequately explained as a, quote, second wave, unquote, or as being caused by a new variant of concern. After an overview of 4 recently published studies that have quantified the April to July 2021 excess all-cause mortality event, we give 10 numbered arguments as to why we conclude that the extraordinary mortality event was caused by India's vaccine rollout in its early stages. Therefore, it appears that the early rollout of the vaccine in India in April to July 2021 was devastating, causing the deaths of approximately 3.7 million residents on the administering approximately 350 million doses of the vaccine. India experienced an extraordinary excess mortality shock in April through July 2021, not seen in any other country in the world. The mortality by week rose to almost 700% of its baseline value in April 2021, based on 90 municipalities in the state of Gujarat. And the mortality by month rose to almost 400% of its baseline value in July 2021, based on 19 Indian states with 1.27 billion population. To be clear, this represents all-cause mortalities that are 7-fold by week and 4-fold by month greater, respectively, than the pre-COVID 2019 all-cause mortalities in India. This 4-month April to July 2021 excess mortality event in India is described in 4 independent studies published in leading medical journals, and it represents the great majority of excess all-cause deaths for the entire COVID period examined since a pandemic was declared by the World Health Organization on the March 11th, 2020. Given the extraordinary characteristics of the 4-month April to July 2021 excess mortality event in India, it is useful to reproduce key figures from the said studies in order to grasp its significance and nature as follows. And there's a graph here just showing the spike at 2021 of heightened mortality. Much higher than 2020, 2019. That's figure 1. And then figure 2 here is reported deaths from all causes in India's Ministry of Health and Family Welfare Management Information System, covering 0.2 million health facilities nationally, 2021 versus average of 2018 and 2019. And there's a tremendous spike from like 200 deaths in these thousands to 500. And you can see it on the screen here on Rockfin if you're watching it. And there's another study of 50,000 adults, monthly reporting of deaths as COVID, including COVID associated and non-COVID by month for 2019 to 2021, and sub-study of 57,000 adults and 13,500 households within the COVID tracker survey. You also see these spikes. So these are incredible spikes. Overall analysis, gender analysis, age analysis, estimated percent change in mortality from average in Gujarat, India from March 2020 to April 2021. Estimated percent change in mortality from average in Gujarat, India from March 20 2020 to April 2021. The solid curves represent percentage changes from early average mortality for each group. 95% confidence intervals were omitted for better readability. The point estimate and corresponding 95% confidence intervals for April 16th, 2021, the week of peak excess mortality, are displayed in text on the right and highlighted with a data point. And you just see the spike of overall percentage, 678% higher mortality over the overall analysis. It's really a remarkable spike. And the genders are roughly the same, and ages are mid-range. Less than 20 years old is 1%. 20 to 40 up 394%. 65 and over up 570%. 40 to 65 up 876%. When such a large, unique, and sudden feature in mortality of all causes occurs in any jurisdiction, it demands thorough investigation if the cause is not empirically obvious, such as a massive earthquake or a genocidal military attack. This holds even during a declared pandemic, given the unique, sudden, unprecedented, and large magnitude nature of the event in India. All of the above-cited authors who have reported on the 4-month April to July 2021 excess mortality event in India have referred to the event as being India's, quote, second wave, unquote, and have used their all-cause mortality evaluations to infer that COVID-19 mortality is potentially largely underestimated by India's official COVID death statistics. In this author's opinion, if that was India's, quote, second wave, unquote, then by comparison, India virtually did not have a, quote, first wave, unquote, and essentially did not have a death-causing pandemic prior to April 2021. None of the above-cited authors who have reported on the 4-month April to July 2021 excess mortality event in India have mentioned the remarkable coincidence that the said excess mortality event coincides in time with India's vaccine rollout, starting on the 1st of March 2021, with those 60 years and older and those over 45 years and having comorbidities extended to all residents over 45 years on the 1st of April 2021, and coinciding in time with the government's 4-day Tika Utsav, or vaccine festival, from the 11th to the 14th of April 2021, in which some 100 million vaccine doses were administered by its completion. Quote, elderly people or those who may not be much educated should be helped in getting the vaccine, unquote, Prime Minister Modi said in Mint, the 11th of April 2021. To appreciate India's vaccine rollout, its official statistics are a reference as follows. And there's a statistical graph here just showing how many people received the dose, at what age group, etc. And it's the Ministry of Health and Family Welfare, CWIN. So these are statistics from the government of India. For the following reasons presented as numbered points taken together, we conclude that the 4-month April to July 2021 surge in excess all-cause mortality in India may largely or predominantly have been caused by the vaccine rollout in its early stages. 1. The mortality event is unique to India, sudden, unprecedented, massive, and synchronous with India's vaccine rollout to the most elderly and most fragile core morbidity residents. 2. By comparison, in relative terms, there were no significant mortality events, and there was no significant cumulative excess mortality prior to April 2021, during more than a year of the declared pandemic. The declared pandemic would have had to spare India for more than a year, while it raged in many other places around the world, before it showed a dramatic manyfold increase in virulence suddenly in April to July 2021, when vaccines coincidentally were being rolled out to the elderly and those having comorbidities. 3. The early rollout of the vaccine was not executed following the original ambitious plan, but instead was at first delayed by implementation difficulties and then boosted by an ad hoc government intervention, which encouraged accelerated blanket and penetrating delivery to the poor, uneducated, and those presumed to be most in need. 4. A similar synchronicity between increased vaccination associated with a government intervention to accelerate vaccine delivery and an anomalous surge or peak in all-cause mortality is observed in connection with the so-called, quote, vaccine equity, unquote, campaigns in the U.S. An anomalous fall 2021 peak was interpreted as being caused by the vaccines and is prominent in the 25 to 64 years age group in 21 states of the USA, most notably including Alabama, Mississippi, Florida, and Louisiana. The data for Mississippi is shown below. This is figure 9, and it shows all-cause mortality peaking in July 2021. And I'll read the figure 9. All-cause mortality by week, light blue, cumulated number of people with at least one dose of vaccine, dark blue, cumulated number of fully vaccinated people, orange, and cumulated number of people with a booster dose, yellow, by week from 2019 to 2022 for 25 to 64 age group in Mississippi. So you can see these higher spikes if you're watching this on Rockfin. In the study by Rancourt et al., 2022, it was concluded that significant detectable by all-cause mortality, vaccine-induced mortality, occurred primarily among fragile groups characterized by high degrees of poverty, disability, obesity, diabetes, and high medication rates. The vaccine injection was seen as an additional challenge, often accelerating and causing death in residents with comorbidities. 5. The magnitude of the April to July 2021 excess all-cause mortality event, normalized by population, is highly heterogeneous from region to region in India. This suggests that the net regional excess mortality is related to the underlying heterogeneity of health status and to differences in health status group selection, which were actually vaccinated in a region, rather than being due to a given infection fatality ratio and its age profile for the rapid spread of an infectious disease applied to all regions similarly. 6. The April-July 2021 excess all-cause mortality event occurs simultaneously across India, as do the national vaccine rollout and Prime Minister Modi's, quote, vaccine festival, unquote, intervention, rather than showing any distribution of starting times, which would be compatible with a spreading infectious disease seeding different regions at different times and spreading at different rates depending on regional differences of social and health conditions. 7. The April-July 2021 excess all-cause mortality, at least initially, is significantly larger on a mortality baseline percent basis for mortality by week for 40 to 64-year-old residents than for 65 and above year-old residents. This is incompatible with controlled clinical studies and empirical observations, which find that infection fatality, probability of COVID-19 assigned death, is exponential with age. However, the age dependence behavior is similar to what is observed for the vaccination period of the COVID period compared to the pre-vaccination COVID period in the USA. 8. The Vaccine Adverse Event Reporting System, or VAERS, of the USA unambiguously shows excess all-cause deaths immediately following injections with each of the 3 types of COVID-19 vaccines used in the USA, with a prominent peak within 5 days of injection and an exponentially decaying excess mortality extending 2 months following injection. The integrated mortality by number of injections following injection, or injection toxicity, increases exponentially with age, as does the batch-to-batch variability of toxicity. The latter observations of exponential increases with age mean that the injections represent fatal challenges in proportion to the frailty of the subject. 9. Detailed histopathological and immunohistochemical autopsy studies have demonstrated that the COVID-19 vaccines are causes of death, both in otherwise healthy subjects and in elderly subjects with comorbidities. 10. We have not found any study establishing that there was a sudden rise and fall of any disproportionately virulent variant of concern that would have been synchronous with or swept through and caused the April to July 2021 excess all-cause mortality event. For example, Dar et al. Postulate that the April to July 2021, quote, second wave, unquote, event in Delhi, the capital city of India, was due to the Delta variant, which would have quickly swept Delhi to become predominant because it would have higher transmissibility in larger immune escape than concomitantly circulating variants. However, the estimate the needed characteristics of Delta by fitting a model into the epidemiological data into the variant predominance estimated by genomic measurements from small, non-randomized cohorts. Leaving aside the large known and unknown uncertainties throughout their exercise, basically, the inferred characteristics of Delta are obtained by fitting to the data, rather than being independently measured in a controlled clinical trial. Under such circumstances, the mortality event creates an illusion of the needed delta, but an actual delta cannot be concluded to have caused the mortality event. In conclusion, it appears that the early rollout of the vaccine in April to July of 2021 in India was devastating, causing the deaths of approximately 3.7 million residents on administering approximately 350 million doses of the vaccine in a population of 1.39 billion. This corresponds to an effective vaccine fatality per dose ratio, or per dose toxicity, of approximately 1%, which is approximately the 100 times the vaccine fatality per dose ratio for the Janssen vaccine administered to 65 and above year-old residents of the USA, calculated from the VAERS data. It is also approximately the same vaccine fatality per dose ratio as is consistent with the anomalous fall 2021 peak in excess all-cause mortality occurring in high poverty states of the USA, which was interpreted as being caused by the vaccine. Frail residents are susceptible to being fatally harmed on injection and should be protected against an overly enthusiastic or politically motivated state-run injection campaigns implemented without stringent individual clinical assessment. And that's the end. So in this article, I think the extraordinary takeaway is that 3.5 million people died in India, or 3.7 million died during 2021. And there's no correlation to a virus, but there's a correlation to this vaccine rollout. And I didn't include or reference the many articles that are here at the end of the document, which you can definitely reference, and you can link and click through and reference this. And it's correlated to this vaccine festival, what they called it, Tika Utsav. And that was done under Prime Minister Modi. And I would be interested to see how this mortality in this region, Gujarat, are to the mortality in Uttar Pradesh, where I think the governor of that jurisdiction applied ivermectin early. So that's a whole nother story, comparing this factual data to some other data in India would be remarkable, but just the Holocaust level of deaths is really off the charts. And what was supposedly attributed to the second wave. So you see that they're blaming a lot of the deaths that are actually occurring from the vaccine on the virus. And again, the title of this article is Probable Causal Association between India's extraordinary April to July 2021 excess mortality event and the vaccine rollout, written by Denis Rancourt, Rancourt, with links here, and reproduced in audio with permission from the author. Thank you for listening.